Good afternoon, Woodstock. Today is Friday, March 27th, and we're doing another video today to keep you abreast of what's happening with the virus. Today we're joined by Dr. Zachary Taylor, the head of the North Georgia Health Department. He's here to let you know what's going on around the county and the city of Woodstock and share his knowledge of what's happening. Dr. Taylor, welcome.
Thank you. Glad to be here.
Our first question is, what do people need to know about COVID-19?
Well, I think people probably have a general understanding that this is a virus, that it's spread primarily through people coughing or sneezing, and the virus is in the droplets of moisture that are expelled when they do that. Those droplets can float in the air for some period of time, and other people can inhale them or get them on their eyes or their nose, and they can become infected. There's also evidence that it can be spread through touch. So someone who has the virus, who's infected, gets the virus on their hand, they touch a surface, transfer the virus to that surface, someone else comes along, touches that surface, then you're not infected through your skin on your hand, but generally by then touching your face, your nose, your eyes, which we all do unconsciously during the day. And that's why we recommend don't touch your face and wash your hands frequently. The virus is currently spreading in your community. You have over 40 cases in Cherokee County. You had your first death in Cherokee County today. And people need to assume that there are people who are infected that they may come in contact with, and they need to take the steps to protect themselves.
Okay, thank you. How can I protect myself and my family?
Well, the best way right now is to comply with the governor's directive, the president's directive, the health commissioner's directive, all of the advice you're receiving from healthcare providers, the CDC, and that's to practice social distancing. That's so that you don't become infected, that's so your family doesn't become infected. So it's a difficult time for all of us, but to the degree that we can, we need to stay in our homes. That doesn't mean you can't go outside and walk or do some activity outside. It's just that you need to avoid groups of people when you do that. We need to stay in our homes. We need to only go out if it's necessary. So if you do go out, make sure that you wash your hands, you use hand sanitizer, and if you get sick, you should, if it's mild and you don't require medical care, you should self-isolate at home and only seek medical care if you actually need medical care. You may want to go into your home and say, okay, if one of us is sick, how can we isolate that person within the home? Because you don't want them in contact with the other family members. So do you have a room with a bathroom that you can set aside for the person who's ill? Make sure you have all of the things that you need. Make sure you have a sufficient supply of food. Make sure that you have all the medications that you need. And really it's disruptive to your life, but it's just a fact of life for us right now.
Okay. And what are the symptoms we look for?
Typically this virus, so a couple things. Incubation period from the time that you're infected is anywhere from 2 to 14 days. It's typically around 5 days. So you're infected, but you really won't start having signs of infection or symptoms until about 5 days. You'll probably have a fever, you'll probably have a cough. You probably will have those aches and pains that we typically associate with having a severe cold or influenza. Some people have some nausea, vomiting, but that's not most people. So really it's fever, cough, and the general malaise that comes with a viral infection.
And if I do exhibit symptoms, you just mentioned what to do at home. Are there any other steps that I could take?
Well, you can always we don't have a treatment for this at this time. You can always take medications such as Tylenol to reduce your fever and cough medicine. You should rest, obviously. You should drink plenty of fluids. But that's really, you're just treating the symptoms by doing those things. We don't want, at this point in time, we don't want our medical care providers overwhelmed by people coming in who have mild illness. So I know everyone wants to get a test. The testing we have for this is still not widely available, or it's limited. There's a backlog of tests at the lab, so the people that we need to know about, we're not getting those results fast enough. So please don't go to the emergency room or to your provider seeking a test for this infection. The only time you should go seek medical care is if you need medical care, not to get a test, but you're having severe shortness of breath or other issues that require medical intervention. Then you should go to your medical provider or go to your emergency room. If you decide to do that because of your symptoms, please call ahead and let them know that you're coming in, that you have symptoms that are consistent with COVID-19, so that they can be prepared to receive you. If you have to call 911 because of your symptoms, please let the dispatcher know that you have symptoms consistent with COVID-19, so that when those first responders arrive at your home, they can be protected also, so that they don't become infected.
So we know that there's a testing site here in Woodstock, and tell me how it's going there.
Yes, we're one of 2 federal testing sites in the state of Georgia, the others in Albany. We serve all of North Georgia, not just Cherokee County. Things are going very well. Our priorities for testing are first responders, healthcare workers, people who provide care to elderly people or to those who have severe illnesses, and then people who are 60 and older, or who have a severe chronic medical condition and who are symptomatic. So if you're a patient of your provider can register you for the site. You'll be contacted to get an appointment. It's a drive-through site, so you just drive up, you get tested, and you go on. I need to tell people that although we have the sufficient supplies to collect the specimens, and we send them daily to the laboratory, the laboratories have such a backlog of testing that's being done, and they haven't caught up with that yet. So it does take several days for us to get the result of the test back. We're doing, and I'm sorry I didn't mention.
Okay.
We're operating 5 days a week, Monday through Friday. On Monday through Thursday, it's 9 to 3 o'clock, and on Friday, it's 9 to 12 o'clock. We're doing over 70 tests a day, and the nurses, I spoke to them just a little while ago. They think they can increase that capacity. So we have plenty of spaces available for Monday. If you need to get tested, work with your provider to be approved for the testing, and once that approval happens and you're given you don't need to know what we call it, but you get a number, and we'll contact you and set up an appointment.
There's been some talk of a vaccine. Have you heard anything new?
Well, they immediately started working on a vaccine, but I think everyone should be aware that vaccine development is not a rapid process, and this probably will be at least a year and perhaps a little bit longer before we have an effective vaccine, get it manufactured, and then we're going to have to obviously deploy that vaccine. So vaccine is, we all want a vaccine because that can provide us the protection that we need. But until we have that vaccine, we're going to be fighting this virus in our communities.
All right. I want to thank you for coming out today. Is there anything else you want to add and tell our audience?
I just ask you all to be patient. And I realize how frustrating it is, how fearful everyone is of this virus. But be patient, continue the social distancing, take care of your loved ones, help out each other. This is a time for us to come together as a county, as a community, as a state, as a nation, and take care of each other so that we can get through this.
Again, thank you for showing up today and sharing your wealth of knowledge. Woodstock, stay safe.